good morning or good evening, depending on where you are. We are very happy and honored today. We have three speakers and two moderators to join us in this webinar on the impact of the COVID-19 on family life in Asia, jointly organized by the Hamad bin Khalifa University and the National University of Singapore Center for Family and Population Research, and the focus on the family in Asia. This is the three organizations that put this webinar together. We are very honored to have three speakers and two other moderators today to talk about the situation in three different countries. Let me introduce the two main drivers for this event and for this large project that looking at how the COVID-19 pandemic has affected family life in Asia. The first person is Dr. Anis Ben Brick. Dr. Brick is Associate Professor and Founding Director of the Program for Social Policy Evaluation and Research at the College of Public Policy, Hamad bin Khalifa University, Qatar. Prior to joining the university, Dr. Brick served as Director of the Family Policy Department at the Doha International Family Institute. He has served previously as a Senior Policy Advisor and consultant to many government ministries and organizations in the Middle East and North Africa region. Dr. Brick serves as the MENA region organizing partner of the United Nations NGO Major Group. He leads this international project on the impact of COVID-19 pandemic on family life across cultures. Later on, Dr. Brick will tell you more about this project. Our second moderator is Mr. Lee Wee Min. Mr. Lee serves as the honorary chairman for Focus on the Family Malaysia, an organization dedicated to strengthening families in Malaysia, which he founded in 1997. He is also the Asian Regional Director for Focus on the Family Global. He was actually trained as a civil engineer. Dr. Lee moved on to something very close to his selling off his business in 1996, and that is family. Mr. Lee continues to actively provide strategic support to the board of associate offices in Asia and mentoring the CEOs, as well as work with government bodies in different countries in Asia and Middle East in the area of family development. He also speaks regularly at churches and conferences locally and internationally on issues pertaining to family. So today we are joining practitioners, policymakers, and academics to talk about how issues related to how pandemic affected family life in Asia. Let me now give the floor to Dr. Brick to give you an introduction on this large international project. Dr. Brick, please.
Thank you very much, Dr. Young, and good morning and good afternoon, everyone. Thank you again to the National University of Singapore and to Dr. Young and her team and the folks on the Family Asia and Mr. Wee Min Lin for co-organizing this event and supporting the project, and thank you all for joining us. As my colleague, Dr. Young mentioned, the impact of the pandemic on the family is an international project that has been conducted in 72 countries, including 11 countries in Asia. And in partnership, as you see the team, we managed to get an international team representing academia, 28 experts from all over the region, representing academia, United Nations, civil society organization. The project has many partners, 10 universities and research center, 17 NGOs across the world, the United Nations, our partner in Asia, the focus on Family Asia, who managed to really support the project, and without them, we couldn't conduct the survey in this important region. As I mentioned, we covered 72 countries from North America to Europe, Middle East, and in Asia. The survey conducted in those countries has been translated into 23 languages, and we used many validated measures. The survey, so in this study, we covered many topics related to the family life, such as the mental health and well-being of children and parents, the marital relationship, and the quality and the satisfaction of both parents before and during the pandemic, the parent and child relationship, child care task sharing, and the issue of unpaid work, motherhood and fatherhood before and during the pandemic. We asked also our participants about the relationship between their family members before and during the pandemic. Another issue which we'll talk about today, which is coping, how those families cope with depression, anxiety, and stress during the pandemic, and the overall satisfaction with their life. Also, finally, we asked the parents about their needs in terms of government policies and support and response. Today, for the sake of time, we'll cover few topics: the mental health, parent-child relationship, and coping strategy. As I mentioned, in Asia, we covered 11 countries: China, Singapore, Malaysia, Indonesia, Philippines, India, Bangladesh, Pakistan, Mongolia, and Australia, and New Zealand. As for today's discussion, just briefly, this is the sample we get response, 1,192 from Malaysia, 1,273 from Singapore, 378 from Indonesia, and 1,421 from Mongolia. So before I pass the mic to my colleagues, just a few slides, just a few numbers. My colleague will reflect on those numbers. So for example, when it comes to the children well-being, gender mental health during the pandemic across the 4 countries, we saw that, as you've seen here in this slide, that children in Malaysia experienced higher range of anxiety compared to other countries in the region. So for example, in the survey, we tried to see who are those children, and the data should tell us that children of single parents, those parents who are widowed or divorced or married but live apart, experienced higher level of anxiety than parents of 2 children. Another aspect we covered, but I don't want to take too much time, which is the impact of the pandemic on the parents' mental health. And the data tell us in those 4 countries that parents in Mongolia specifically has experienced higher level of severe and extremely severe depression during the pandemic compared to other parents in the other 4 countries. And when we checked who are, whether men, father or mother are experiencing depression, we saw that in fathers, specifically in Malaysia and Mongolia, experienced it, as you can see here. The father in these 2 countries experienced a higher level of severe depression compared to mothers. Another aspect we try to look in the survey is the anxiety, the level of anxiety among parents. And the data tell us that parents in Malaysia and Mongolia, again, experienced higher level of anxiety. Again, fathers in the 4 countries here, without any difference, the father in the 4 countries experienced more anxiety than mothers. The other factor, briefly, which is stress. to what extent pandemic created a stressful situation for parents. And parents in Indonesia and Malaysia experienced higher level of stress than other countries. Again, fathers experienced higher level of stress than mother. As you can see, overall, fathers are more affected than mother, which is not expected, at least in other region. Another factor, briefly, which is we look into the parent-child relationship in those 4 countries. And as you can see, overall, in this region, in the 4 countries, the relationship between parents and children has improved during the pandemic, except Mongolia. So the parents in Mongolia experienced it, or the relationship decreased specifically in Mongolia. And as we can see here, there is different element, different area in the parent relationship. For example, here in Singapore, parents' involvement, parents' communication with their children improved in the pandemic. In Malaysia, as you can see, many elements in parent relationship has improved, except parental support and satisfaction with parent was decreasing. Interestingly, and unlike other countries, parents in Indonesia, or the relationship between parents and child relationship has decreased or deteriorated in the pandemic, and many factors: parental support, satisfaction with parents, involvement, all decreased during the pandemic. Finally, in Mongolia, as you can see, very similar to other countries, that the overall relationship between children and their parent improved overall during the pandemic compared to the previous situation. Finally, the coping strategy. What are the coping strategy used by parents? How they manage the stress and anxiety? And we can see here the most important 5 factor or 5 strategy used across the 4 countries. Acceptance, parent accept the situation. Religion is an important factor. Active coping. So overall, the parents in this region, in Asia, are somehow positive compared to many other regions. In other regions, in Europe or in Latin America, we found that many parents coped with using alcohol, substance abuse, or self-blame. But here, as you can see, overall, for an outsider like me, outside Asia, we see that the parents in Asia are somehow more positive when dealing with the pandemic. The same in Malaysia, the same in Indonesia. In Indonesia, they have only one specific factor, maybe is different than other, which is seeking emotional support. Parents, they got support from the family member than other region. But still, as you can see here, the religion is still there, an important factor across all the countries. Again, thank you very much for giving us this opportunity. My colleagues in the next panel will in detail reflect and provide you the context of the 4 countries. Thank you again, the National University of Singapore, and Dr. Yong and Dr. Lee and Mr. Lee Wee Min for having us and partnering with us. And I look forward for a fruitful discussion today. So now I will turn to my colleague, Mr. Lee Wee Min, for the first panel to discuss the mental health. Thank you very much.
Thank you very much, Dr. Brick. Let me first congratulate you and your team under the College of Public Policy at the Hamad bin Khalifa University in Qatar on the successful completion of this global study on the impact of the pandemic on family life across culture. And today, we're going to look at, in particular, the region of Asia. Thank you too for the opportunity to be involved in this study involving 72 countries, particularly in the area of data collection at the grassroots level. And I'd like to also take the opportunity to thank Professor Jin Yong, the Founding Director Center for Family and Population Research, Department of Sociology, the National University of Singapore, and your very capable and competent team of people for hosting this webinar today. To all the speakers, Dr. Vincent Wong, Joanna, as well as Honguru, we want to thank you for taking time to support this webinar today. I'm a civil engineer by training, as has been introduced. In 1997, I actually turned from being a civil engineer to engineering civil society by addressing the needs of family needs and efforts in strengthening families. The last 23 years, I am a firm believer in building bridges, not the civil engineering kind, but building bridges between the academia, researchers, as well as practitioners, which is basically the civil society. I think one cannot do without the other. It's a symbiotic relationship. On a day-to-day basis, the two will always need to function together. As a practitioner, we cannot be doing what we feel like doing or what we like to do. And as an academia and researcher, we cannot also be proclaiming on what is right to do, but there are no hands and feet to do it. So we can see that both works very closely and symbiotically one with another. Constantly validating what we are doing so that we know what we are doing is valuable for the civil society. So when Dr. Brick invited me to participate in this particular research, I lit it up straight away and felt that it is really important. This event of the COVID-19 is unprecedented, and therefore it is important for us to know what needs to be done, what are the things in family life that are being affected, how is it to be done, and what are the areas that we need to be addressed, because we really believe in not only the relevance of program, but also the reliability of our program. So I'm so happy to be involved in collecting data over the last few months for this particular research, and today we are able to present to you the finding. So without further ado, let us begin the first session on the impact of the pandemic on parents' health. Before I introduce Dr. Vincent Wong to speak to us, I overheard when I was going to supermarket not too long ago, two fathers talking to one another. And they were just talking about the effect and the impact of working from home. We call it WFH, as a result of the pandemic. One of the father has a 4-year-old, and he said, I have to send my 4-year-old to the babysitter because if not, I can't just do my work. It's really affecting me mentally. Then there was this other father who says, I have a 5-year-old and I couldn't send him to any babysitter. And I must say that it is stressing me tremendously. And I guess the results that we got, which was briefly shared by Dr. Brick, testify that fathers, unfortunately, would be one of the group that has been more affected or being stressed more as a result of the pandemic. So today, we are so glad that we have Dr. Vincent Wong to share with us a little bit about the whole effect of how the pandemic is affecting us mentally as a parent. And Dr. Vincent Wong is a consultant psychiatrist. You would be able to read more about him from the brochures that were being sent to you, but certainly he's a man who has got a lot of experience. I'm very happy to have worked with him on a number of occasions and also to refer him some of the people whom we come across that may need some help in this area. So without further ado, let me introduce you, Dr. Vincent Wong.
Well, after listening to Dr. Ani's talk, I think I should be having double stress. Firstly, I'm a father. Secondly, the fathers are all coming to me for help. Yeah. Well, I just want to thank everyone. Welcome on board for this meaningful webinar. And ladies and gentlemen, thanks for your precious time for tuning in. I will be actually presenting in a recorded version for this talk to ensure a smooth talk. So therefore, Wee Min had graciously agreed to help me, Wee Min, to play the talk, but I'll still be tuning in as well, and I will welcome question and answer after the session. So to you, Wee Min.
Okay.
My introduction. Ladies and gentlemen, Good afternoon, perhaps good morning to some of you. I bring you warm greetings from Malaysia. First of all, I would like to congratulate Dr. Anis Van Brick team from the Hamad bin Khalifa University, Qatar. Prof. Jin from Center for Family and Population Research, National University of Singapore, and Mr. Lee Wei Min, Focus on the Family Asia, for organizing this timely event during this challenging time for families. Thanks to Mr. Lee, Asia Regional Director, Focus on the Family Global, for inviting me personally with this sharing. My name is Vincent, and I'm a psychiatrist currently practicing in Kuala Lumpur. I have only 15 minutes, so without further we need to exercise caution during this pandemic because the virus is still changing and mutating, and we need to take all efforts as advised by WHO not to spread. Each day we are bombarded by data and statistics relentlessly on the number of cases and also the number of deaths, people who are affected by COVID-19. And as we can see, United States of America is heavily affected, followed by India, Brazil, Russia, many European countries, and many parts of the world. And it is saddening, to say the least, to see that US has recorded more than 300,000 deaths due to COVID-19, followed by a country in Asia, which is India, about 143,000 deaths. Recently, I attended a grief conference, and
I'm shaking, you know. Just to
let me
let you know.
share this quote by Professor Dr. Ken Docker. He's an expert on grief reaction. Yes, he said that the pandemic of COVID-19 would be followed by a pandemic of grief because of the manifold, multiple losses that we need to deal with, and all of us need to go through this journey adjusting and readjusting even as the virus evolves. However, our hope is that we all could weather through this storm by staying resilient, by banding together as one community, one global community, even as we journey through until we reach new normal in the near future. Or perhaps we are all going through different levels of new normal each month. One of my friends in Australia uses this term. He said we all need to recalibrate ourselves to continually adjust. A term which I like very much, and it is very true. Let me share with you a study from India. In fact, and actually this study is called a systematic review. Means that it pulls together many studies from all over the world, you know, and therefore trying to come to a conclusions. It doesn't only study patients in India, but also the people in other parts of the world, and to look at the psychological issues among the three groups of people. For one, people infected by COVID-19, two, healthcare workers who are the frontliners, and number three, general society and general population. And they found that among all these countries, the highest rate of psychological issues still falls on people who are infected by COVID-19. And this is followed by healthcare workers who are the frontliners who need to deal with this serious virus. As we know, there were many challenges. For example, during the early time of the pandemic, there was lack of personal protective equipment, and healthcare workers have to treat patients with some degree of fear and anxiety. And the third is the general population. And another point is we are all concerned that the pandemic will be followed by global economic recession, and it is time and again proven that economic recession may further affect our mental health. Further analysis of the prevalence of psychological issues for general population specifically, and this systematic review found that at least 1/3 of respondents reported feeling highly stressful, what we call stress reaction. At least 1/3 actually had insomnia or sleep difficulties, and about 26% struggle with anxiety, and 24% struggle with depressive illness. We know that some of the causes for this are due to the perception of threat of this unseen enemy virus, COVID-19 virus, the mortality level, death rate, especially for the elderly. Particularly, we're anxious when we are staying with some of our elderly family members. Stigma and the discrimination attached. Briefly share with you, one of my patients actually was diagnosed COVID-19 before her surgery, and she was sent to a COVID-19 hospital, and she was actually traumatized by the whole experience at the hospital, and she was having a very difficult time. Lack of vaccine available, lack of definitive treatment has rendered us a lot of fears of uncertainty. So what are the impacts of the pandemic on parents' mental health? Let's say it affects us as individuals as well as parental role. Malaysia, the government has initiated the Mental Health and Psychosocial Support Services, or the MHPSS, to provide practical assistance and counseling for those with emotional and family issues. Focus on the Family Malaysia has played their part to organize many bonding activities during this time, and this is done virtually via many online platforms to keep the family strong to weather through this challenges. Let me share a little bit about the mental health and psychosocial support services helpline. Some of the data that has been collected from 25th of March until 19th October. Total calls were 36,269, and an analysis of the reason for calling, up to half of them were related to stress, anxiety, anger, frustrations for the pandemic, and depressed feelings. And 8.8% are due to family issues and domestic violence, and more rampant during this time. So let me share with you 6 aspects of the impact of the pandemic. It can be broadly categorized into 6 major aspects, namely physical effects of the pandemic on mental health, psychological aspect, social aspect, financial, educational, and last but not least, spiritual effects. Let's begin with the physical effects. One of the most obvious physical effects is the mandatory requirement for physical distancing or social distancing. Personally, I favor the term physical distancing because this is what we should do to keep ourselves at least 3 meters apart each other, 2 to 3 meters, and because socially distancing would have been appropriate because we're supposed to be more socially connecting time. And on my right is a slide shows during the election in Singapore this year, where government exercised strict physical distancing to ensure a smooth election without aggravating the COVID-19 and holding the sanitizing bottle has become second nature to all of us, unfortunately. The other physical aspects includes work from home, and there are issues as well as silver lining for working from home. And honestly, there are many people who come to my clinic because working from home, it actually contributes a lot of stress to them, and going through the screen each day causes fatigue, mental fatigue, and the lack of social interaction. What I mean is real social interaction, like talking and giving a pat, each other giving a nudge, as a sign of encouragement. These are all lacking when we go virtual. Boundaries issues, sense of control of personal space, trying to find a work, family balance, at home, managing distractions from children at home, and tons of emails, as well as overflowing messages. Silver lining of working from home, as we know, includes the that we don't need to get caught up with the traffic jams, which is a bonus, and having more time at home. As you can see from the picture, on the right, the little boy enjoys daddy and was having his breakfast, perhaps checking his emails. However, on the left side, both parents seems to be quite stressed out with work, with distracting these kids hovering around. Nevertheless, I had sometimes I do some study conference with my patient, and I still remember one of the a mother was talking to me on Zoom, and then her little children will come and hover around her and lean on her. And when the mother asked the child to move aside, I actually told the mother, I said, it's okay. You know, I said, it is a very, very good sign of positive attachment with your child. That is a good sign. Other physical effects of the pandemic includes the lockdown, causing feelings of being trapped. On my right is a picture of the lockdown in Indonesia, capital of Jakarta. People, especially the lower income group, are having to cram up in a small space. This triggered a lot host of issues such as congestions, noise pollution, and if the marital relationship is not good, it could easily trigger domestic violence or abuse. Anxiety of being infected, transmission to elderly family members is a common concern. Next, we move to the psychological effects after the physical effects. As we can see from the research which I shared earlier, there is definite higher prevalence of anxiety due to the unseen enemy in COVID-19. There's a higher rate of depression due to work-related issues, and people who struggle with pre-existing mental health issues such as obsessive compulsive disorder, which characterized by frequent washing or checking, and to wash even more during this time. One issue is about grieving. I will share with you an unnamed patient. This lady had to grieve over her dad who actually passed away in Taiwan, and during the pandemic, during the movement control order, or we call it MCO in Malaysia, lockdown, and she was unable to travel to Taiwan to go through the normal ritual of being, and it caused enormous distress to her and the whole family. Funeral arrangement was restricted, or some much absent at the height of the pandemic, where so many family members passed away in one community, and we know from news portal there were massive burial in certain hospitals, and this is very, very sad. Silver lining to kind of mitigate the psychological effects is the availability of Zoom that allow virtual connection. As compared to the pandemic many years ago, during the Spanish flu, no internet and no, people were literally isolated. Thirdly, the social effects of on parental mental health. Smiles, if we are wearing this mask, yeah, smile become a thing in the past, yeah, when we go public, and invitation of family outdoor activities, extended families, invitation, going to the kopitiam or the coffee shop for a nice chat, now a thing in the past for some countries. Able to go out for exercise or group exercise like Tai Chi or Qigong is being limited. In friends for Mahjong, all these community activities, dance, singing, choir, yeah, karaoke, yeah, it's all limited. And many patients come to me because of disruption of their normal healthy routine. There's a lot of anxiety, restlessness. Financial effects is very obvious on parental mental health, retrenchment, unemployment, pay cuts, and closure of the Malaysian-Singapore border, affecting thousands of, and not forgetting some of the foreign workers in Malaysia who earn by daily wages. They are actually the vulnerable community because they are the first workers to go in a company, in any organization, because they are daily earning wages. Very, very disheartening and sad. And about education and aspects and parent mental health. As parents, we became more concerned because of the study plans was disrupted during the pandemic. Online lessons were far less effective than physical lessons. Some parents were reluctant or concerned to send their children to overseas studies because some of those countries were heavily affected by the pandemic. The higher prevalence of online gaming activities, which is a concern time. The silver lining for this is there are higher accessibility to many free online courses, theater, as well as museum, and so that we can all tap into this resource. Last but not least is spiritual and parental mental health. Religious gathering activities were limited. House of worship, like churches, mosques, temple, out of bounds during lockdown, and community outreach programs or welfare activities. On the flip side, the silver lining of this situation is the higher accessibility to many online preaching or sermons all over the world, which is all made easy and online. Secondly, family should take this precious opportunity to spend more time to pray together and to connect on together more home. Yeah, and thankfully, having online platform, we can have virtual meet which allow large cross-border meet for many countries is now the new normal, just like this current webinar. So take-home message, ladies and gentlemen, the impact of the pandemic is massive and may permanently change our lifestyle and our family routine. It is a fact. The impact of the pandemic on individual families, communities, nations, and globally is still evolving, has not fully unfolded. As parents, need to be mentally prepared, continually adjusting and adapting to evolving changes each day, each month. And last but not least, thriving families is always the key for a thriving nation. So with that, I'll leave you with a quote from Professor John Cassioppo. And one of my favorite quotes. He says that our ancestors on the savannas of Africa were really good at one thing. They were banding together into groups and cooperating with each other. Just like bees evolved to live in a hive, humans evolved to live in a tribe. So we need to band together and go through this together as a global community. So with that, I thank you so much for your kind attention. Back to you, Yimin.
Well, thank you very much, Dr. Vincent, for sharing with us those thoughts. We do have a couple of questions, but before that, one of the questions was pertaining to the collection of the data. And I just wonder if Dr. Brick could actually give us an insight on how were the data collected before we direct the question to you, Dr. Vincent.
Yeah, thank you. Thank you, Mr. Lee. I think I responded to all the questions through the chat. Okay. But yes, because I was listening and at the same time answering, because I know that we have to give more time to Dr. Vincent to answer the question. Yes, for the data collection. Now, first, thanks again to my partner, Dr. Lee and his team, and folks on the Family Asia for translating the survey into Chinese, Malay, Indonesian. So the survey was translated into many languages, including Indian, Tagalog, Hindi in Tagalog, etc. Then the survey was conducted through my partners, folks of the family, through online survey, mainly through online survey. But of course, we know that one of the limitations of this study is to cover all let's say, all member of the society. We know that some member of the society don't have access to internet or in remote area. But in other regions, we faced similar challenges, such as in Africa. And thanks to our partner there, we managed to collect data in remote area through face-to-face interview, or we use it many times in Latin America and in Asia and in the Middle East, in refugee camps. We use it phone interviews. So through our partners, we managed to conduct the survey through phone or face-to-face in some countries.
Yeah. Okay. Thank you, Dr. Anis. Maybe I just add on to the questions by Marilyn Lim regarding it looks at that the data suggests fathers have a higher level of anxiety and stress. I agree with Dr. Anis that sometimes the sample may not represent the whole society, number one. And from the what I see on the ground, you know, my day-to-day practice, I think both working father and working mother are equally affected by the pandemic because they have to juggle with work and family and children, financial, or even taking care of their elderly parents. And although I think one of the reasons why fathers may, because it is an average figure, you know, it comes up with an average figure. So perhaps culturally in Asia, fathers a higher percentage are sole breadwinner of the family compared to the Western culture. So on an average score, we may see a higher level for the sole breadwinner. Yeah, but for mothers, working mothers in Asia, they have to juggling with work and family. I always call them super mothers. Yeah, I mean colleagues who work and juggle. I call them super mothers, and I always salute them. And I think they have at least the same level of stress, if not more, higher level of stress compared to the working fathers.
Okay, thank you very much. We really appreciate the questions that are coming in, but for the sake of time, we may not be able to address all of them. Maybe after this, if Dr. Vincent could just type in the answers while we just address one more question, all right? And this is question from Kui Shu Feng. Dr. Wong, thanks a lot for your great talk. Could you make further comments on the role of religion in this pandemic, of which you alluded to, especially how the religious faith affect people's health behavior in the pandemic, and how the religion-based social network plays a role? Could you just help us to address that before we move on to the next panel discussion?
Yeah, thank you very much for the question. It's a good question. As I mentioned, the whole 6 aspects of coping with the impact and coping with the pandemic, spiritual aspect is certainly a very important aspect. I think having a spiritual aspect, or perhaps a spiritual community, it can be any religion. You know, you could be a Muslim, or it could be a Buddhist. You know, it could be any Christian or Sikh or any other religion. I think usually it is associated with a supportive community. Yeah, so number one, there is a supportive community to lean on to support one another, especially emotional as well as spiritual support. So we have the emotional support. You can fill up each other's emotional tank. But 2, you can pray for one another and the spiritual support. Secondly is we have not just the worldly understanding of what is happening. Okay, you know, we also have a spiritual understanding and a spiritual in the sense that, you know, if you believe there is a creator, and you know, some people will look upon the creator for a sense of hope and a sense of especially hope. And also I mean, personally, I am a Christian, and I believe that, you know, the creator is still will still help us to journey through this situation, and perhaps to look at the silver lining, you know, that perhaps it helps the whole global community to come together. So all this spiritual coping will help us to weather through all these challenges.
Thank you, Dr. Vincent. Being the first moderator, I have a tendency to hijack the time of others, but I will not do that. Let me just end with a quote that I received this morning incidentally. It says, "Your calm mind is the ultimate weapon against all your challenges. Always stay calm and relax." So with that, Dr. Anis, I'll leave you to moderate the second session. Thank you very much.
Thanks, Wimin.
Thank you very much, Mr. Lee. And now I'm very pleased to introduce our second, speaker for the second panel on the impact of the pandemic on parent-child relationship. And please join me to welcome Ms. Joanna Koho, the CEO of Focus on the Family Singapore. Ms. Joanna, the floor is yours.
Thank you. Hi, everybody. Thanks for spending the afternoon with us. It's heartening to know that many people are concerned about the family and want to do something about it. I want to know, you know, what lessons we can take from the pandemic with regards to family life. I'm not sure if you can see what's happening on screen, but this is probably what parent-child relationships look like these days, especially if you're outdoors, where you have to even interact with your children through cloth or through some kind of fabric. I'm just going to very quickly cover some general observations. This will be specific to Singapore because that's where our work is, and maybe allude to a couple of comments or observations that came out of Dr. Anis' study. Okay, so some general observations, and then going into the impact on parents, and of course, because we're exploring parent-child relationships, the impact of the pandemic also on children, and some conclusions or considerations for us. Whether as practitioners or academics. Okay, so for most parents, the pandemic has really meant that the boundaries between work and home are not just blurred, but they have disappeared altogether. Okay, in Singapore, we are quite famous for abbreviations, and with the pandemic, we've had three letter abbreviations, HBL and WF. Which have become very, very well known. I'm not sure if that's the same abbreviations used in other parts of the world, but for us, the pandemic really means home-based learning, that's HBL, where the schools are closed, and so therefore, you know, school comes into the home, and parents now have to be the teachers or the assistant teachers. They need to learn what goes on in school, in class, and assist their children, even with the devices, so that the children can log in and you know, do school from home. At the same time, work from home, that's WFH, has also become mainstay. So what you see on screen in the middle, you see a poor mom. She's like, and I think most of us are like that, right? Probably not half in this way, lengthwise, but probably horizontally, where we dress up only on our top half because that's all you can see on the screen. But that's what it has been with regards to parenting in the pandemic. And interestingly enough, I think this has come out from a lot of parents. We've heard that they're stressed, you know, they don't have enough sleep because, you know, sometimes certain families would be sharing a single device and it has to sort of go around the home. In Singapore, where space is very, very scarce, and I think Dr. Vincent earlier alluded to it as well, you know, they might be sort of climbing over one another. Okay, and very interestingly, we actually did a number of mini surveys, not as comprehensive as what Dr. Anis did with his study. but we did a mini, 3 to 5 minute kind of surveys. And the very first one we did was actually shortly after Singapore had our own version of lockdown, which we call the circuit breaker. And it was in conjunction actually with our Mother's Day campaign. And we wanted to find out what was the impact on moms. And you'll see that we actually did a similar survey the year before. And so we could kind of compare pre-COVID and what was happening now with COVID. And you'll notice that actually 2 of the mom's top 3 challenges are similar. And that would be coping with both work and home, okay, what we call work-life harmony or work-life balance, work-life integration. And the second one being to manage their kids, okay. Of course, managing kids' behavior pre-COVID, during COVID will be managing kids, just because they are around all the time. What was different, of course, with COVID, top 3 was families, health and safety, which wasn't there before. Previously, it was household management and chores. And I guess with the fact that we are dealing with a global pandemic, something that we've never had before, with many, many unknowns, this was probably quite understandable. Okay, so again, comparing mothering pre versus during COVID, you'll see that previously, previously, when we did a similar survey the year before, in 2019, we found out that, this whole idea of mom guilt was quite prevalent. 4 in 5 mothers would experience it. 70% of moms get angry or frustrated. It's just simply because they're overworked. Many of the moms we surveyed, majority of them were working moms. When COVID hit, we found that moms were just as stressed, just as irritable, just as tired. If anything, probably increased levels of stress, such that now 60% of moms were actually rating their stress levels 7 out of 10, which actually puts them at risk even of a mental health issue. Okay. When we went on further to ask what is it that moms would need in order to help them, in this time of COVID. Interestingly, the needs pointed to 2 areas. One was support from their husbands. And then you'll see the kind of support that moms are looking for, quite a bit of like emotional connection, emotional support. And of course, because managing their child's behavior is one of the top 3 challenges, so they're looking also at parenting support. This wasn't just moms. When Father's Day came along, we did another mini survey amongst dads. You'll see that, in fact, this was the first time ever we did a survey just for dads, and we had overwhelming response of almost double the number of respondents from the moms. And we found out that, dads also experience this parental guilt, okay, which we now call dad guilt. It's interesting because I think earlier Professor Anis mentioned that dads were feeling very stressed and in fact higher rate of depression and anxiety during the pandemic. Yeah, and I'm not sure that this could be a result also of the pandemic, because we don't have, unfortunately, pre-COVID data to compare this with. But dads also mentioned that what they struggle with, apart from, again, work-life balance and managing their children's behavior, what was interesting and very different from the moms is that dads struggle more with the financial pressures versus moms. Their top 3 became family's health and safety. And I think this kind of relates to how, at least in this part of the world, in Asia, I think we still have a bit of that expectation that the man is the main breadwinner of the family. And so in a way, I guess this kind of shows up that dads still feel responsible for providing for their family's physical as well as financial needs. Again, what do dads need and want? Well, with the now discovery that dads also can suffer from what's called dad guilt, dads essentially indicated that they wanted increased involvement with their family. And interestingly, the lockdown or circuit breaker, as we call it in Singapore, enabled them to do that, enabled them to spend more time with their children, enabled them to be more involved. Again, I think that showed up in Dr. Anis's study as well. So moving on, if we were to just assess, the state of parent-child relationships as you can tell, we tried to do a little bit of a pre and post. It's actually interesting. Again, I think this corroborates with what Professor Anis has discovered, and that is the pandemic has actually improved in general parent-child relationships. Okay, so father-child relationships as well as mother-child relationships showed at least 2 times that improvement, or rather 2 times as many dads or moms report that their relationship with their children has improved versus deteriorated. Okay, so that is some positive news that has come out of the pandemic, but I guess the proof is in the pudding, and so we should go to the children and find out if, you know, the parents are just being delusional, right? Or we're kind of assessing the situation very, very differently and not accurately. And so again, for the first time this year, we did a survey on children. This would be Singapore children, and I was kind of amused by the findings that, you know, I would have thought that Singapore was fare maybe the worst amongst the 4 Asian countries that Dr. Anis presented, but it seems like Singapore's not doing that badly. And perhaps the reason being that the stresses may not be caused by the pandemic per se, as much as the normal things that children in Singapore, families in Singapore are stressed by, and that's exams. And so this came out in our newspaper as the headlines, where children in Singapore are more anxious about exams than COVID-19. And this was actually taken from our survey results, as you can see on the right-hand side of the slide. So in terms of managing their stress, how do children then relate to their parents, and how does that parent-child relationship help to mediate the anxiety or the stress that they might feel? The good news is that even when we ask the children, most of them, 7 out of 10, okay, would say that they are close to both dad as well as mom. And I think that's for us, at least in Singapore, you know, that's a real hats off to the dads, you know, who have stepped up. Not just during the pandemic, but I believe in the past few years, because one of the things that we have done in our nation is to have a national fathers movement to kind of encourage and increase father involvement in our children's lives. However, what we did find was that boys and girls, you know, the way they connect or relate to dad versus mom is very much in different ways. So this shows a breakdown. And you will notice from this chart that what is common, whether it's, you know, sons or daughters with dad or with mom, is that they are all looking at having those chats, you know, informal conversations, casual conversations with their parent, and then actually, according to, you know, how they self-rated, helps them to feel connected and loved by their parents. Okay. What is also interesting, as you can see here, is that when it comes to relating to dad, you know, both sons and daughters kind of see dad more as maybe activity-oriented person, doing things together or going out together as a family, even making trips together. Of course, the overseas trips would be affected by this pandemic. With mom, it's more talking, you know, not just casual conversations, but even going beyond that to deeper sharing for the sons with mom. And for both sons and daughters, they do look to their moms for verbal affirmation. I think this is worth noting for moms because, you know, oftentimes we are known to be maybe a bit of a nag. I know, you know, as a mom myself, it's really out of concern and out of love. But I think our children would appreciate, you know, more of the positive affirmation coming from us. In terms of comparing what the child would prefer to how the parent perceives, you know, their connection with their child, it's quite interesting that, you know, casual conversations, that does come up both from the parental perspective as well as the child's perspective. And so for father towards daughter, casual conversations is one of the top 3 preferred ways of connection, the same way it is from the son or from the daughter towards their dad. Okay, but again, you'll see that, you know, when it comes to relating to dad, whether it's son or daughter, they are looking at dad being the, you know, activity guy. Yeah, doing things together, and through doing things together, connecting. With mom, on the other hand, a little bit different. Okay, casual conversations or chats are still there. Yeah, but again, you're looking at the child wanting more deeper sharing of verbal affirmation from mom. Okay, mom on the other hand sees it as, in order to connect with my child, my preferred mode is actually doing things together. So maybe this is where for moms, now, and this was actually also still done in this COVID period. For moms, maybe we don't need to busy ourselves too much with finding things to occupy our children with, but sometimes it's just sitting down with them and having a good chat, heart-to-heart chat. Okay, so parenting in the pandemic, to sum it up, when we first started, I think many parents sort of saw it as a real challenge, and just in going through our Facebook live shows that we've been doing during this period of time, we've realized that that's kind of reflected it as well when Mother's Day came around, which was in April, May. It was just, parents are just struggling, struggling with family life, struggling to make sense of HBL, WF, H, work from home, and struggling to maintain or keep up with that parent-child relationship. And then the school holidays hit, and it was a very different kind of school holidays where you can't go out and you're stuck at home. The whole family's stuck at home. Yeah, and that became like a nightmare, probably more than anything else. But I think as the months went on, parents started to take on quite a different perspective, and you'll see that by June, it was about how the pandemic was kind of challenging parents to look at their parent-child relationship in perhaps a different way, and maybe a more positive and constructive way as to what the good can come out of the pandemic. So in short, I put here that in the Chinese language, the word crisis, it's called 危机, is actually comprised of two characters. 危 means danger, but 机 means opportunity. And I guess, in any crisis, and this pandemic would be a global one, it presents either danger or an opportunity to make good out of it. And I would say that, it's just heartening to know that when it comes to parent-child relationships, I think, at least from what we can see in Singapore, there are many families who are making good out of this crisis as an opportunity to connect with their children more strongly. And this is a large part because now that they have time with their children at home, time that previously, would have been spent, I think Dr. Vincent alluded to it, commuting to and from work. But now with that time saved, at least they have time on hand to turn that into quality time. Parent-child relationships can become and have become to some extent more intentional, where parents are indicating that they do want to learn how to parent according to their child's needs, according to child's personality. They want to learn a little bit more about themselves as parents. And I do believe it spells some positivity for parent-child relationships in the new normal ahead, where connectedness it goes beyond physical connections or physical presence. But I think families are learning that in that parent-child relationship, we need to have emotional connectedness. Yeah. So with that, just one mention. Okay, it's not all upside. There are a few things that we might want to pay attention to, and really that is with regards to the relationship. I know I'm talking more and sharing more about the parent-child relationship, but really what some of the survey results have hinted at is that we may need to look at the husband-wife relationship. Okay, as moms express their need for emotional support from their husbands, unfortunately, only 5 in 10 would say that they are getting it from their husbands. And similarly, early in the year, even before, sorry, this was last year. Yeah, so this was even before the time of COVID. We know that marriages are actually being challenged to some extent, yeah, whereby husband and wife may not feel that they are each other's confidants or support. And at Focus on the Family, I believe globally, we have to say that the best gift that you can give your child is really to love your spouse. Yeah, and even as we look at the good results or good outcomes on the parent-child relationships, I think it's also a reminder that we need to go back to establish the foundations of the parent-child relationship, which lies in the parents' marriage. Yeah. So with that, thank you very much, and yeah, we'll have questions.
Thank you very much, Mr. Joanna, for this interesting presentation on your study in Singapore, which clearly aligned with our findings regarding parent-child relationship. And thank you for mentioning the importance of the quality of marital relationship. In fact, our survey also included the marital satisfaction or marital relationship across the 72 countries. And this is, we know from research that the parent-child relationship could be explained by other factors such as the mental health of children, the mental health of parents, but also the quality of the relationship. Now, for the sake of time, maybe we'll take some questions. So I have a question. Did your survey include the domestic violence? In our survey, we included that part as a part of the parent-child relationship, and whether domestic violence against children mainly has increased in Singapore. Our result shows in many regions that yes, there are many aspects of the parent-child relationship has improved, such as the involvement of parents in education because of the lockdown, many regions, communication sometimes, but also many other parents also struggled with disciplining children, and one of the result of this pandemic is increased domestic violence against children. So did you cover that in your survey?
Unfortunately, like I mentioned, our survey is really a straw poll kind of thing. So we didn't ask specific questions dealing with that. But I do note that there's one question that asks about, the respondents of our surveys, and whether maybe because they're maybe more middle class or upper middle class, and those families tend to fare better. I'm not sure, because actually we did go to the community groups. The children's survey, for example, went out through schools, and these would be a good range of schools, from what we call your neighborhood school to maybe a bit more of the one or two elite schools, but a good enough range. And I must say we were quite surprised that families seem to be faring so well. Of course, there's also the timing of it. Like I mentioned, when we did the very first, this is what I just presented, is a collection from a few different straw polls, if I might call them that. And the very first survey that we did was actually for the moms, and that was just right after Singapore had its lockdown. And I think when those results came in, it started to indicate that families weren't doing so well, moms particularly weren't doing so well. But as time went on, the last survey that we did was actually the survey with children, and I must say that we were also a little bit surprised that the way the children were perceiving this pandemic and the way they saw their connection with their parents. Perhaps, I can only hazard a guess, but it could be that maybe to our surprise, and it's a good thing, families have kind of rebounded well, or kind of taken up this crisis and turned it well into an opportunity.
Excellent. So just because I received many questions regarding the variation, and maybe to highlight that what we presented, both of us, is just an aggregate data. Of course, there are many variation, and in our surveys, we included many variables that might explain this variation, in addition to demographic variables such as income, education level, the gender, but also there are many other factors also that might explain the result. For example, the lifestyle, or whether the family, whether the parents are single parents, divorced parents, or two couples, or whether the family are unemployed or employed, and depends on their income, depends on their education level, as I explained. But also we include other factors such as lifestyle, whether the the parents are addicted, alcohol addicted, or whether they're smoking. So there are many socioeconomic factors that may explain the result in one specific context, but also might explain the variation across culture. You mentioned also the religion previously. For our survey across the 72 countries, the religion has been mentioned as one of the factors, even in a country that represent themselves as secular, such as Norway or Sweden or France. So there are different variation, of course, definitely for many reasons. But what we presented here, just a snapshot, a brief snapshot of the result, just to give you an update what the pandemic has caused. I think it's time to move to the next panel. I'm happy, and I think also Ms. Joanna, happy to answer your question in the Q&A chat room. If you have any further question, we are happy to answer that. So thank you very much, Ms. Joanna, for this interesting result, and thank you for your insight. Now I will give the mic to my colleague, Dr. Jean Young, for the next panel. Thank you very much.
Thank you, Dr. Brick. Our third speaker is Ms. Hongozu Chuya. And Ms. Chuya is the founder of the Focus on the Family Mongolian, and she founded that in 2015. She's now an adjunct faculty member in the Mongolian National University. She's been providing counseling to people who are mostly suffering from anxiety, depression, and personal disorder using the psychodynamic object relations approach. So today, she will be sharing with us the experience in Mongolia on the coping strategies and family resilience. Ms. Hongozu, please.
Hello, everyone. It's my pleasure to share with you all on the topic, coping strategies and family resilience. So in this topic, we will discuss about what is resilience and why COVID-19 is stressful for the family and family resilience. What are the coping strategies and also for the family. So let's look at the definition of the word resilience. So according to APA, so it is the adapting well in the face of adversity and stressful situations. So we all know that COVID-19 is a very unpredicted situation, new situation for all of us. So resilience is the ability to withstand adverse events and stressful situations without falling apart by actively and positively coping with the stress. So the word resilience is equals to the word stress tolerance. So the reason why the COVID-19 is stressful for the families because nobody predicted the impact and widespread of this virus, and also nobody knows when it will be under control. Although there is a vaccination now, it's a very good news, but we don't fully know when it will be fully controlled throughout the world. And also, it is a danger signal to the physical and emotional well-being, and because you know it gives a fear and stress to our gives the signal to our brain that it is something dangerous and harmful because the virus is deadly. And the third impact is financial difficulty. Because of COVID-19, families are really having income decrease or losing jobs. So it's a big concern for the family. And then the fourth one is family issues. So when the family member is getting sick or having the tested positive with COVID-19, or the relationship issue is also coming up because all the families are staying together. So because of that, domestic violence is also rising, and also family communication and isolation. And when the family members are in different parts of the world, they cannot be reunited. So these are all causing stress to the families to some extent. So actually the stress itself is not really all negative. Actually the stress helps us to do something, to take some actions, or to protect ourselves from the danger. So that is why the stress response is more important than the stressors. So the word resilience, remember, is equals to the word stress tolerance. Yeah, so prior family resilience is a strong factor on how family is coping with current stressful situation. So I looked at also some surveys done in Italy, and those families spend time together before COVID-19 are less stressed during COVID-19. So that means if you spend lots of time on your work, less time on the family, then now during the COVID, you have more time with your family. Actually, you feel stressed because you never had a close or strong emotional bond with your family. So now when you are in this new situation, you don't know how to communicate with your family members, or how to be there with your family members emotionally. So being physically be with your family is different than being emotionally with your family. So that's why the family bonding really matters. For example, we have this secure attachment or insecure attachment for each family, and that is also a strong factor on how we are coping with stress. Yeah, so that's why, and also the flexibility is also one factor that determines how you also cope with stressful situations. Yeah. So what are the coping strategies? Let's look at some points. So warm, gratifying family ties predict physical and psychological health throughout development. So so if you are strong in bonding, like if you have an emotional bond with your family members, that is when you feel calm, when you feel secure, and when you feel that you can protect yourself, or you can thrive in a difficult situation. So that's why when the parents are calm, so the children will be calm. So when the parents are aware about their emotional state, and they're able to regulate their emotions, and they are able to manage their emotions, that's how they will relate well with their children. So when the parents are calm, then the children are calm. So also, if you have a very strong affectional bond with the parents, Dr. Alan Shore, a neuroscientist, said that if you have a good eye contact, and also our tone of voice is not very high, and also touch, for example, hugging and touching. So all these components bring a good emotional tie with your family members. So, and also being parents are holding environment for the children. So psychoanalyst Winnicott said that the mothers are holding environment for the babies. So I adopted his term, but the parents are holding environment for the children. And when the parents spend time together with the children, and usually the children won't show any behavioral issues. And if they show love and affirmation and care for each other, that's how they feel calm and happiness and joy. So I'm glad to hear the service done by Dr. Ennis, and also in Singapore, that this lockdown period is actually enhancing the relationship between the parents and the child. Is a good result, and also being good enough parents. So sometimes, you know, the parents are very over worried and anxious about we should do this and we should do this and perfect. Then they feel guilty if they don't feel meeting the perfect parent roles. But when we are, what does it mean by being good enough parents is when we really be there for each other's emotions, and really receiving the emotional cues and signals, and responding to the psychological emotional needs of each members of the family. That is already enough. We don't strive for perfectionism. It's okay not to clean our house like perfectly, or sometimes just make an easy, you know, meal. It doesn't have to be like all perfect in that sense. So psychological needs are only met in the relationship. So when people feel lonely, and if they feel that they are all alone in this pain or difficult situation, that's when they create depression. So if the person has only one person who cares for them, if they have this sense of feeling, it helps them to not have a depression. So that's why, and also when the psychological needs are not met in the relationship, people turn for the other things as a coping mechanism. For example, substance abuse, or internet games, video games, you know, all kinds of other things to substitute the intimate relationship. So if they don't have a close intimate relationship, that's when they turn to other unhealthy coping mechanism, such as drinking and smoking, and or caffeine, or etc. So coping strategies actually require flexibility. So flexibility is the ability to change one's emotions and thoughts and behaviors to unpredictable situations. So our goal is to have a positive emotions and positive thinking and positive behavior in these unpredicted situations. So how do we do that? So of course, in any crisis, it creates strong emotions in people. So they feel fear, they feel confused, they feel anxious, they feel hopeless, helpless, worried, exhausted. So that's why first we need to express our emotions. In order to have positive emotions, first we need to recognize, know how we are feeling in this COVID-19 situation as a parent, as an individual, or even for our children. That's why we need to listen one another, and listening not only what they are thinking or what's their opinion, or how do we resolve this issue, how do we cope, but first, how are you feeling in this situation, in order to express our emotions. So only after we express and process our negative emotions, then we will have positive emotions like joy, happiness, and hope. So that's why active listening is not listening just to the content of the information. It's the ability to listen one's emotions. So as an Asian, we tend to emphasize a lot on our thoughts. What are you thinking? But oftentimes don't really share how we are feeling. And we don't know even, we don't really find emotional words to express our emotions. That's why we need to learn about these things. And then after expressing our negative emotions, then we also need to remind on a daily basis ourselves as a family, tell one another, good time will come and we can do this together and everything is going to be fine. So this situation is temporary. And so each day, this kind of affirmative words will really help us to go through this time. And also, so what are the positive actions we can take during this time to cope in this situation is, of course, breathing technique. So when you feel fear, danger, so your heart beats very rapidly, or you feel tense, and it really affects your body function. So in order to have a very fast, calm down, you need to learn how to take a deep breath, and not only for yourself, even for the children. So even if you are feeling angry, and first you need to calm down in order to communicate well. That's when the parental relationships or issues doesn't get resolved if you don't really manage your emotions, right? So the breathing technique helps you to calm down very fast. And then the daily exercise is the second number one de-stressor. And a number of studies show that if you exercise 30 to 40 minutes, 3 to 4 times weekly, it reduces 40–70% of having a depression. So it's a natural way to boost the serotonin level in your body. So that's why daily exercising with your children even helps to de-stress during this time. And third thing is a healthy meal. So when you feel stressed, sometimes you tend to overeat or crave for unhealthy food. Like that's why your sugar intake increases, and that's why we have to watch our meal during this time. So in order to build our immune system and also not create depression, we need to eat healthy, like lots of green vegetables and lots of water, take lots of fluid, and also fruits, lots of fruits. So, and of course, we need to abstain from alcohol and drug usage. And then another coping we have is individual time. So now we are spending lots of time as a family, right? But because we also individual beings, we need an individual time. Sometimes when you are overcrowded with people, you need to have a personal space or personal time. That's why, you know, even if you are with the family, sometimes you need your own soul time, solitude. So you need to have your own time during this time. So listen to the music or read or any enjoyable activities you like to do. And then family time. So I read one study that eating meals together 3 times a day will reduce the risk for developing depression. So having meal together 3 times a day will really help you to feel connected, and also listen to one another, talk to one another, and also having regular family time, play together. And so another thing is that, of course, it impacts the family, our daily routine time, this situation. We need to come up with the plan. How do we work on our daily routine? So sometimes, like, if knowing that, oh, I don't have to go to work, you know, then you tend to sleep late. Then all your daily routine is affected because of that. But having enough sleep, or going to bed before late at night really helps you to also distress and good brain health as well. So that's why going early to bed and waking up early, all these routines needs to be worked out as a family member. And also limit social media usage. So I don't know about in other countries, but in Mongolia, sometimes the false news are really spreading, and people read the false news, and then because of that, it creates lots of anxiety and stress among people. So we always only recommend to have access to resources, news that are more reliable, coming from the reliable sources, and not share the false news on the social media. And also, because because of the online classes, children are spending more time on online, and so we need to reduce also this time. For example, online gaming, or all these things. Yeah. So that's why yeah, we need to come up. So also the study suggests that if you are working from home, sometimes you need to wear your office wears in order for you to feel that you are working. So that also helps you in your working from home, and also having a personal space, and both for children and also those adults working from home.
Mm-hmm.
Yes. So we need to have a plan for the self-care and also family care during this time. And self-care plan for our physical and also psychological health. And so the community support is also very strong factor for the family support. So as a family, as a community, you know, encouraging frontline workers or helping those who are in need. For example, in Mongolia, during the lockdown, you know, it's affecting the income. So that's why some families are concerned about their food. So as a community, you know, even the government is helping those families with the food supplies, or, you know, or sharing family activities on social media. All these things also help each and every family to really together to overcome this situation as a family and as a community. So, and also in that, the government is also really taking the role in helping families, you know, providing some solutions. For example, in Mongolia, the government recently decided to cover the electricity and utility costs for each family in Mongolia until next June, for example. This also helps to reduce the worry for their income. So, and also the government also helped to reduce the fuel cost at the 75%. Those who need the fuel to have a warm gear or house during the harsh winter time, for example, and also the providing food coupon. So all these things really helping us to feel that we are all together, you know, as a community, as a family, we are going through this time, and we can all, you know, overcome this situation. So happiness is defined as the ability to feel satisfied with one's life, to enjoy oneself and others, and to have fun. So this time is really helping us to ask the very important question. So what is the meaning of life? So what is really important in our life? So that is really, you know, helping us to think and spend time together, the importance of the relationship, and enjoy each other at home as a family and community. So yeah, thanks for your attention.
Great. Thank you, Ms. Chuya. We have a few questions here, and thank you for sharing with us all the coping strategies that include staying calm, be positive thinking, be a good listener, take deep breath, and eat healthy, sleeps, and so on. So these are very helpful strategies for individuals to relieve their tension and depression. I have questions about how government can respond to support family resilience. You talk a little bit about this already at the end, such as reducing the fuel cost for families, those who need fuels. Are there other things you would like to add about government's roles in building family resilience?
And yeah, so the government is also reducing the tax for the like organizations or companies on the social income tax. So that is also helping the business runners or owners and to have not to have a to not lose the employees and sustain the position for them, and also providing some allowances, monthly allowances for the children on a monthly basis. So these are the government support for the families. Yeah.
So given that this pandemic is a public health concern, Is there anything that government would do specific to health-related issues to help the families?
Yeah, so government also providing some help and support for the frontline workers and giving them allowances, and also we have a mental health hospital and mental health workers, both government and non-government. We are trying to provide how do we take care of ourselves, especially the mental health, because of course the physical health is important, but this time is also affecting lots of stress, anxiety, depression. Numbers are increasing. That's why the mental health is important. That's why the mental health practitioners are all in this together, trying to help the families with the resilience and coping strategies.
So you have a tough job on your hand. I think Dr. Brick's presentation, if I remember correctly, shows Mongolia as pretty high depression among the parents. So that's something is interesting to note. One of our participants who is interested in knowing how did Mongolia did so well in the pandemic so far. Is it mostly because of the border control? Because we're seeing very few cases, low levels of infections.
Yeah, our government did a very good job, early intervention. So the lockdown actually started since February this year, very early. So borders are closed. So that's why, yeah, this really helps, and also provided self-protection also.
Okay, great. We have a few more minutes. Let me try to pick up a few other questions that for all respondents, for all speakers that were not addressed before. I think one question was addressed to Dr. Ennis. You outlined 6 aspects of impact of the pandemic. And the question is, to what extent do you think these are long-term or short-term impacts?
Do you mean the overall structure of the survey?
Yeah, the impact of the COVID-19 pandemics. Do you think they're likely to be long-term, or is it short-term, mostly short-term impact?
Well, it depends. If we just take one aspects such as depression, which we know that depression overall and anxiety has some, if not treated properly, will have a long-term impact. Another factor which not covered in the presentation, which might have a long-term impact in both children and parents, which is the internet addiction and screen time. In our survey, we included that factor, to what extent the pandemic has increased screen time of children and parents. And this is a factor, a new type of addiction that will have a long-term effect if not treated well. We know because of the lockdown, many parents, including myself, spend a long time on screen. And one of the coping strategy to manage children is the use of or giving them more screen time. And my observation here in our neighborhood, even here in Qatar, most of the families bought PS4, the PlayStation, for their kids during the pandemic, just to get rid of them, to get rid of their headache, give them iPad, give them a PlayStation, and keep them calm. And will have a long-term impact. Another factor which might have a long-term impact, which is the violence, domestic violence among couples or domestic violence against women and children. And this is, again, if not treated well, and there is services which have a long-term impact. In addition to the mental health, we know it has a long-term impact. So yes, the pandemic created some challenges long-term, but I think there is a need for intervention from civil society, from government, for proper services provided to parents and children to reduce the long-term impact of those challenges.
Thank you. Another question is for everyone. Given that Asian families are known to be, or Asian society is known to be more family-oriented, I think people are curious to know that whether Asian families advantage in coping with COVID-19 pandemic this time compared to European or other families in the other continents. So you have lots of other countries to look at. What is your impression? I think anyone can answer that, or Dr. Ennis probably.
Now, in our survey, we covered another factor. Of course, we covered different variables, and we always have the assumption that family values will play an important role in the coping and the resilience of family compared to the individualistic societies who are more less family oriented. And so far, we found that the intact family, the two parents family, in the, let's say, the family oriented culture, not only they're coping better, but only there is a difference in the way they cope. They cope more in a positive way rather than individualistic society. But also we found until now, and we are doing the data analysis as we speak in many regions, that those families in pro-family culture or values manage to, or they are more resilient than other families. There is a variable covered in our survey, family resilience, is to manage how the family not only coping, but how they're responding, how they're resilient to the shock. So those families in Asia, in some part of Africa, in the Middle East, in some part of Latin America, they are more resilient than other family in Northern Europe or North America. So yes, family oriented culture or values shows that play an important role in coping, in resilience, but also, as I mentioned in my presentation, that one of the coping strategy is the reliance on what I call the family capital. Families supported each other, whether it's a single family or the extended family. Another factor we covered in our survey, which is the intergenerational solidarity, whether families supported other extended family member, such as elderly or one of the relatives. And we found this is an important increase in the pandemic in the family-oriented culture such as Asia. So intergenerational solidarity has improved in those pro-family culture. So overall, our data shows how important family in not just the pandemic, how important family to protect families, to increase their resilience, and to create a family capital. Clearly today, across the society, across many cultures, family capital played an important role to reduce the impact of the pandemic.
Thank you. Another question is, are there any positive impact that comes out of this pandemic on the family relationship? I think we heard some that says that relationship comes closer. Are there other things that all speakers and our moderators want to highlight, positive impact that comes out of it? Anyone?
I think I can share with you the result, but I will share my personal experience. I'm a father of 4. for kids, 2 boys, 2 girls, 9 years and 7 and 6. And I work from home since March. And one of the positive thing as a father of 4, the first thing you will notice that you understand that you are a father. You recognize that you are a father actually. Because before the pandemic, yeah, you have kids, just fine. It's a nice idea. But the first time you try to understand your kids, you will learn from them. The first time you hear them and you know that they are a different person, they have, you know, their hobbies. It was very tough in the beginning, the transition period, because it's tough with all the, but the first thing I noticed personally, it's, I have better relationship now with my kids. I know them very well. I know that they are there, and you learn. Even I'm doing research on parenting, and you value now. I think I personally I value the work of mothers. This unpaid work. I think before fathers, at least me, that's my perception. We take it for granted. Yeah, the mother is doing that, but now I think I watch my wife doing this, and I really value what she's doing. It's great work and paid work, and with all the stress, work stress, family stress, and dealing with kids, it's not just a tough job. It's an impossible job for non-trained father. So this is, I think, this is one of the positive aspect of the pandemic. And personally, I believe that yes, the pandemic created many challenges, but depends how we look at those challenges. For me personally, every challenge is an opportunity. I think this pandemic opened many opportunities for us to learn from our kids, to understand them, to value what we have, to value our partners, to value the family members. Many people, yeah, take it for granted that we have cousins or we have, but this is shows now that friends or the social capital, friends and family supported and has a major role in this pandemic. This is a personal experience.
Thank you. Dr. Vincent, do you have anything to add?
I think I totally agree with Dr. Anis. I think he have put it so wonderfully about the important role of mothers, even, I mean, homemakers at home. And I think, I mean, my wife is a homemaker and I value her. I think they don't have a specific working time. They work throughout, and they have to juggle with many roles. They are, you know, they are cooks, they are teachers, they run errands. And so I think we are more understanding. I'm more understanding of my wife. Secondly is, I think dads who are forced to work from home, hopefully this is an opportunity for them to be more involved in their children. As one questioner posted it, I think parenting should always be a joint venture between dad and mom. So traditional fathers are usually less involved, but I think we need to have a paradigm shift. Yeah. So in this new normal, we need to take on new roles to work alongside with our wives to be more not just involved in the errands, but also emotionally involved in our children, connecting with them, playing with them, and spending time. Yeah.
Fantastic. We hope to see a change in gender role and behavior. Let me give the last words to Mr. Lee for today's event. We have a few words.
Thank you so much. Thanks so much, Dr. Yong. I was just thinking on the question that you were talking about. I think both Dr. Anis and Dr. Wong has shared about from the family perspective. I have the privilege of working with 7 offices in Asia. And then Focus has got other offices in Africa, Costa Rica, in the United States, in the Middle East. But one of the things that I have observed, it's the spontaneity and creativity of people as a result of the pandemic. That there's only one mean and one channel of connecting, and that's really online. And to see how the officers and the staff are coming together to come up with creative programs so that they continue to reach out to their constituents is something that has really impressed me, that mankind has a lot of creativity that yet to be explored. And I think this pandemic has put them in a situation where creativity has gone like exponentially over the last 12 months. And I'm encouraged with that. I know, as Dr. Ane said, that there are many challenges, but if we begin to look at the positive development as a result of this, I think we need to be encouraged and to press on. And again, to make use of the data that has been collected to help us with our program, because I'm quite sure right now, immediately, I think I would ask the team at Focus to spend a bit more time to reach out to fathers. Obviously, that's a particular demographic that we need to stretch out our hand to a little bit more and to support them in whatever way that we can. So thank you once again for giving me this opportunity. Yep.
So we have come to the end of the webinar. I want to thank all the speakers and the moderators for your contribution to the success of this webinar. Again, congratulate to all the speakers and Dr. Ennis and Focus on the Family for successful conduction of these research. I'm sure we will see a lot more results, findings coming out from this in the future, more of the comparative literature and research finding to share with others. I know that you will have many more webinars that focus on different continents. So we look forward to seeing a lot more findings coming from you, this humongous, wonderful research projects. Let me thank Hamad bin Khalifa University and the Focus on the Family in Asia to collaborate with us, partner with us for the Center of Family and Population Research in the National University of Singapore. And this webinar has been recorded, and shortly we will be putting the recording online as well. We will be sending you some information about where to access these the recording. So thank you again for participating in the discussion and for your presentation and moderation. Thank you again. We hope to see you again in our future event. Thank you. Good night.
Thank you. Thank you, Dr. Yong.
Okay, thank you.
Thanks, Anis. Thanks, Dr. Anis.
Thank you very much. Thanks,
Thank you, all
everyone.
the speakers.
Thanks for having us.
Thank you for everyone.